Welcome back to the Anti-Cancer Lab. If you're new here, pull up a chair, you're in good company. This is where I read the cancer studies most people never see and tell you plainly what they actually mean for you. No fear, no hype. So grab a coffee and let's look at this one together, because today's is a little different from what I usually do, and it's one I think everybody over 50 should hear once. Quick note before we go a single step further. I'm Dr. Becker. I'm a researcher, not your doctor, and I've never had cancer or treated a single patient. Everything I'm about to tell you is me translating published studies for general education. None of it is medical advice, and none of it is a diagnosis. If you have a symptom that worries you, the answer is never a video. The answer is your own doctor. I'm going to say that a lot today, and I mean it every time. Now let me start where this really lives, not in a chart, on a man's belt. I sat with a fellow last winter, call him Frank, 63, and he told me about a belt. For a few months he'd been quietly moving the buckle in, one notch, then another. He wasn't dieting, he wasn't trying. He actually felt a little proud of it at first, the way we do. He'd say, well, must be all that walking, and his wife would nod, and nobody said the word that was sitting in the room. Because here's the thing about the organ we're talking about today, the pancreas. That little gland tucked behind your stomach that makes the enzymes you digest food with and the insulin that runs your blood sugar. It sits so deep and so quiet that when something goes wrong, it doesn't shout. It whispers, and the whispers all sound like ordinary life, a loosening belt, a meal that suddenly sits wrong, a tiredness you blame on your age. So let me tell you honestly what today is and what it is not. This is not a video to scare you. Pancreatic cancer is not common, and I need you to hear this next line more than any other one I'll say. Most people with the signs I'm about to describe do not have pancreatic cancer, not even close. Almost every one of these has a boring, harmless explanation that's far more likely. But this cancer has a reputation for being caught late, and the reason it's caught late is exactly because the early signs are so vague that people, and yes, sometimes even doctors in a rushed 12-minute visit, wave them off one at a time. The people who catch it early aren't the lucky ones. They're the ones who noticed that a change was new and persistent, and didn't go away, and took it seriously enough to get it checked. That's the whole video. 6 things to know, so that if they ever show up as a cluster, or one just won't quit, you go get it ruled out instead of moving your belt in one more notch. Let me be careful with my language before I start. I'm not going to tell you any single symptom means cancer. I'm going to tell you what each one is, why this particular gland can cause it in plain English, what almost certainly explains it instead, and the exact moment it stops being a shrug and becomes a reason to pick up the phone. All right, let's go. The first one is the one the textbooks put at the top, and for good reason, because it's often early and it's hard to explain away. It's called jaundice, which just means a yellowing. The whites of your eyes go yellow first, then the skin. And here's the tell that makes it different from a bad night's sleep. Your urine turns dark, tea-colored, and your stools go pale, almost clay-colored, chalky. Some people get an itch all over their skin with no rash to show for it. Now why would a gland behind your stomach turn your eyes yellow? Because the pancreas sits right up against the tube that drains bile from your liver into your gut, the bile duct. A little growth at the head of the pancreas can press on that tube and back the bile up, and bile is yellow-brown. It's a plumbing problem, and the color is the leak showing up in your skin. Here's where I slow you down though. The far more common cause of jaundice is not cancer at all. It's a gallstone or a hepatitis or even certain medications. Most yellowing is not sinister. There's a detail worth knowing that helps you tell the two apart, and it's the reason the textbooks use the word painless. A gallstone blocking that same duct usually announces itself. It comes with a sharp, doubled-over pain in the upper right of your belly and often a fever, the classic gallbladder attack. The yellowing that worries a specialist is the quiet kind, the kind that just creeps in over a couple of weeks with no drama at all, no pain, no fever, sometimes with that all-over itch and nothing else. Painless, creeping yellow is the one I would never ever sit on. If your eyes or skin go yellow, in either flavor, that is a same-week doctor visit, no debate, not because it's cancer, because it needs an answer, fast, and only a real exam and some blood work can give you one. And let me add one small, honest correction to something you might have heard. You cannot spot early jaundice reliably in a dim bathroom mirror, and the faint yellow that some perfectly healthy people carry in their skin isn't the same thing at all. The place it shows first and clearest is the whites of the eyes, in good daylight. If you're ever unsure, that's not a reason to squint harder at yourself. It's a reason to let a professional look. Now, that's one. Here's the second, and this one hides in plain sight because it wears a mask everybody recognizes. New diabetes, specifically brand new type 2 diabetes, or a sudden loss of control if you already had it, showing up after age 50 in someone who is not gaining weight. And this is the part that surprises people. Sometimes in someone who is actually losing weight while their blood sugar climbs. Let me say that more carefully, because I don't want to alarm the millions of people who develop ordinary diabetes. The overwhelming majority of new type 2 diabetes is just diabetes. It comes with weight gain, family history, the usual story, and it has nothing to do with your pancreas being sick in this way. But the research signal here is real and is genuinely interesting, because the pancreas makes insulin. A growth on it can quietly disrupt your blood sugar before it does anything else you'd notice. Studies following people with new-onset diabetes after 50 find that a small slice of them, a small slice, turn out to have an early pancreatic problem, and the odds go up when the diabetes is new, the person is thin or losing weight, and there's no family history of it. There's a second wrinkle here that's just as worth knowing. It isn't only brand new diabetes. If you've had well-controlled type 2 diabetes for years, and suddenly your numbers climb for no reason you can point to, no new dessert habit, no missed pills, no explanation, that sudden loss of control in a stable diabetic is part of the same research signal. The pancreas that used to keep up just can't, and it slipped in a way that shows on your meter before it shows anywhere else. I'll tell you what I'd actually do with this, honestly. I would not panic about a diabetes diagnosis, and I don't want any of the millions of ordinary diabetics watching to either. I would simply make sure my doctor knew if it arrived out of nowhere, in my 60s, with no way to explain it, or if long steady numbers suddenly went haywire, and I'd let them decide whether that pattern was worth a closer look. That's it. Awareness, not fear. And now number 3, the one from the title, the one that shows up after you eat. This is really a little family of signs, and they all trace back to the same simple failure. So let me give you the picture and then the plain reason. It goes like this. A meal you used to love suddenly sits heavy and wrong. You feel full after just a few bites, way too soon. There's an ache in the upper middle of your belly that can bore straight through to your back, and it often gets worse after you eat, or when you lie down at night. And then the one people are most embarrassed to bring up, so they don't, and I wish they would, the stool changes. Greasy, pale, bulky stools that float, that are hard to flush, that leave an oily film. The doctors have a word for it, Steatorrhea, which just means fat in the stool. Here's why the after-eating timing matters, in plain English. Your pancreas is your fat-digesting factory. Every time you eat, it's supposed to squirt out enzymes that break down the grease in your food so your body can absorb it. If something is blocking or crowding that gland, the enzymes don't get out, so the fat you ate sails right through you undigested. That's the oily floating stool. That's why it shows up after a meal, especially a fatty one, and not when you're fasting. That's why a rich dinner suddenly disagrees with you when it never used to. Now, the honest part, and it's a big one. Every single thing I just described is far more commonly caused by something completely benign. Early fullness and greasy stool can come from ordinary indigestion, from an intolerance, from gallbladder trouble, from irritable bowel, from a dozen things that will never hurt you. One greasy stool after a plate of fried food means nothing. What I'm describing is a pattern, a new, persistent change in how your middle handles food that lasts weeks, that pairs upper belly to backache with those oily stools and shrinking appetite, and that just doesn't settle. That pattern, held together over time, is a reason to get looked at, not tonight's uncomfortable dinner. The change that stays. Let me put an opinion on the table right here, my honest red. If I had to pick the one cluster on this whole list that people talk themselves out of the longest, it's this third one. Because it's private, and it's a little gross, and it's easy to blame on age or on that spicy meal. Frank, the man with the belt, he had this one too, and he told me later he'd been quietly changing what he ate to avoid the discomfort for half a year before he ever mentioned it to anyone. Half a year, not out of foolishness, out of the very human hope that it would just go away. I'm not telling you this to frighten you. I'm telling you so that if food starts treating you differently, and it stays that way, you say it out loud to a doctor instead of rearranging your plate around it in silence. Which brings me to number 4, and it ties the first 3 together. Unexplained weight loss with a fading appetite. And I want to be precise about that word, unexplained. If you're walking more, eating less on purpose, chasing grandkids, that's explained and good for you. What we're watching for is the weight that leaves when you're doing nothing to lose it. The trousers that get loose while you're eating the same as always. Frank's belt. Why does this gland cause it? 2 ways at once, really. If your pancreas can't release its digesting enzymes, you're not actually absorbing the calories you eat, so you can eat a full plate and still starve a little. And a growth anywhere in the body can quietly raise your metabolism and steal your appetite. Now, the caveat, and please hear it. Unexplained weight loss has a long list of causes, most of them either treatable or benign. An overactive thyroid, depression, a change in medication, a dozen ordinary things. But it is never a symptom to simply admire. Losing weight without trying, past a few pounds, that's persistent. That always earns a conversation with your doctor. Always. It's your body spending money you didn't authorize, and you want to know where it's going. Number 5 is that upper belly pain again, but I want to give it its own moment because of one specific quality. New, persistent pain in the upper middle of your abdomen that radiates through to your back. That front-to-back signature is worth knowing because the pancreas sits deep against your spine, so when it's irritated, the ache doesn't stay in front, it drills backward. People often describe it as worse when they lie flat, and a strange bit of relief when they curl forward or lean over their knees. Here's my careful hedge, and it's an important one, because I don't want to turn every backache in America into a panic. Back pain and belly pain are 2 of the most common complaints there are, and 99 times out of 100 it's a muscle, a disc, a bit of gastritis, an ulcer, something ordinary. Garden variety back pain does not mean your pancreas. What raises the flag is the combination. Upper belly pain that bores through to the back, that's new, that won't quit over weeks. That pairs up with any of the other signs on this list, and especially that's worse after eating or lying down. One symptom alone, in isolation, usually means very little. It's the cluster and the persistence that tells you to stop guessing and go get an answer. And the 6th is the quietest of all, and the one almost nobody knows. So let me give it to you plainly. 2 things live here. The first is a fatigue that's out of proportion, a tiredness that sleep doesn't fix, that arrives with no reason you can name. And the second is genuinely surprising. A blood clot, deep in a vein, most often in the leg. The doctors call it a DVT, a deep vein thrombosis, turning up with no obvious cause. A leg that swells, that aches, that goes warm and red on one side, with no injury to blame. Now why on earth would a pancreas cause a clot in your leg? This is one of the strangest and most real associations in all of cancer medicine. Certain cancers, and the pancreas is near the top of that list, can nudge the blood into a stickier, more clot-prone state. They shift your body's chemistry toward clotting. So sometimes, and I want to be honest that this is uncommon and rarely the first sign, an unexplained clot is the body's very first flare sent up. Old physicians actually gave this a name more than a century ago, because they kept noticing clots appearing in people who later turned out to have a hidden cancer of the belly. It was one of the first clues medicine ever had that a tumor could reach out and change the blood itself. What you'd notice at home is simpler than all that history, though. One calf, or one thigh, that swells while the other stays normal. A warmth to it, a tenderness when you press or stand. Not both legs, not a general tiredness in the feet. One limb, changed, for no reason you can name. Here's the cold, honest truth, though, so you don't misuse this. The vast majority of blood clots have nothing to do with cancer. They come from long flights, from surgery, from immobility, from certain medications, from 100 ordinary causes. A DVT is a medical emergency in its own right, no matter what causes it, because a clot can travel to the lungs. So a swollen, hot, painful leg is a get seen now situation, regardless. The cancer link is just one more reason not to ignore it, especially when it shows up out of the blue with none of the usual explanations. Now let me be as straight with you as I know how to be, because this is the part that matters most. I just gave you 6 things, and I know exactly what some of you are doing right now. You're sitting there running down the list thinking, I've had that, and that. My back's been off. I felt full last Tuesday. I know, because I do the same. So let me slow you right down. Having one of these, even 2, on an ordinary week means almost nothing. Every one of these signs is far more likely to be something harmless. I said it at the start, and I'll say it again at the end, because it's the truest thing in this whole video. Most people with these signs do not have pancreatic cancer. The people who catch this thing early are not the anxious ones who diagnose themselves off the internet. They're the ones who noticed a change that was new and that was persistent, that lasted and clustered and didn't settle, and who took that seriously enough to go get a real answer. That's the entire lesson. Not fear, attention. And here's the honest limit of what I do here. I read the studies. I can't examine you. I can't feel your belly or run your blood work or scan you, and neither can any video. And you should be suspicious of anyone online who claims they can tell you what's wrong from a screen. There's no simple home test for this, no supplement that catches it, no food that prevents it, and I'd be lying to you if I said otherwise. The only thing that catches it is a real doctor, a real exam, and the right imaging, ordered by a person who's actually looking at you. That's not the disappointing answer. That's the only honest one. So here is your one thing this week, and it's free. Not a supplement, not a food, not a scan. It's a decision you make in advance. Decide right now what your line is. If any of these shows up new and won't leave, yellow eyes, or brand new diabetes with no way to explain it, or food that suddenly sits wrong week after week with those oily stools, or weight quietly slipping off, or upper belly pain boring into your back, or a swollen, painful leg out of nowhere, that's not a wait and see. That's a phone call. And when you make it, use one clear sentence that gets a busy doctor's attention. Say, I've had a new persistent change and I'd like it evaluated, and I want you to help me rule out anything serious. If it fits, it is completely reasonable to ask, could this involve my pancreas, and is any imaging worth doing? You're not being dramatic, you're being the person who noticed. Write that line down and put it on the fridge, because the whole difference in this disease is measured in the weeks between noticing and asking. You don't hold the outcome of this in your hands. Nobody does, and I won't pretend otherwise, but you do hold one thing: attention. The willingness to notice a change instead of explaining it away, and the nerve to say it out loud to someone who can actually check. That's not nothing. That's the lever you've got, and it's a real one. Use it. Bring it to the people caring for you, and let them do the rest. Frank did, eventually. And whatever the news is at the end of that phone call, the person who called early always gave themselves the better version of the story. Keep it simple. Keep an eye on the changes that stay, and I'll see you right back here. Bring a friend who needs this. This is one of those you send to somebody you love. And tell me in the comments, has your doctor ever caught something early just because you spoke up? I read every one of these, and your stories help more people than you know.